Hello, my name is Dr. Nikki Scheiner. I'm a consultant psychologist. I used to work in the British National Health Service. I now work privately. I have my own clinic, which is based in Harley Street in London, and I also work around the world on Zoom. I'm not a medical doctor. I'm a psychologist, which is a doctor who deals with the mind. Obviously, in my work, I work very closely with doctors. I work with GPs. I also work with medical specialists, so rheumatologists, neurologists, cardiologists, you name it, I work with them, and that's very helpful. I work with psychiatrists, I work with neuropsychiatrists, and I really value working with people because I learn from them and I learn from their expertise, I learn from their knowledge. And I think that collaborative working, a multidisciplinary approach, is really helpful for the patient. One of my bugbears, certainly in the UK, is that for too long we've been operating in silo medicine. That means the mind in one corner, the brain in another corner, and the body in another. And I believe very, very strongly that the days of Descartes are gone and that it is very, very difficult now to separate mind, body, and brain. That's a lovely question, because becoming a psychologist, I don't believe was for me a vocational choice. I think that since I was a child, I was always interested in people's behavior. So, you know, my mother's behavior, my brother's behavior, why people could be lovely in one situation and terrible in another. And I didn't know about psychology as a science. Now that I've been working for many, many years as a psychologist, I'm not sure that I believe now it is a science. It is definitely founded on scientific principles. I think that understanding there are models of the mind is a really helpful way for understanding difficulties. However, I believe that psychology is more of an art, and that as we are each an individual, we cannot apply a scientific model to our problems. So it may help us to have an idea, a model of the mind, but ultimately the understanding of anybody's life experience depends on a close understanding, a relationship between people. The most rewarding aspect of my job, I suppose, is helping people, or even witnessing people, dismantle the obstacles that they themselves have erected, which get in the way of them achieving the life that they want. And it's really interesting for me because in order to operate in the world, we have to believe that what we think is right. Otherwise, we'd be crazy. We need to anchor ourselves in the world. And we do that by our convictions. And going to therapy and just standing back and having that quiet time to reflect helps us understand that actually our convictions haven't always served us well. And that process of reflection and sometimes an epiphany, but an awareness, a realization that, oh, what I thought doesn't work for me any longer. Watching that unfold gives me massive pleasure because it's not what I do in therapy. So obviously, I'm not a magician, I work with people, but it's what the patient does to empower themselves. That's the most rewarding part of my work. I think that my patients value my authenticity. I think they value my honesty. I think that going to therapy and being with somebody and you just don't know who that person is a very disconcerting experience for a patient, because apart from anything else, it highlights, it emphasizes the power differential in the therapeutic relationship. And I think by being myself, and I've never known how not to, is helpful for people, because I think it helps them allow themselves to be vulnerable and do the work. It sounds like I'm always challenging people. I don't sugarcoat stuff, but I only challenge people if I believe that a challenge would be helpful for them. I think that my patients find me as very compassionate. I'm often moved by people's stories. I think that's about it. So I think being real in the therapeutic encounter and being compassionate and listening, that's what I do. I don't actually have a mantra or a catchphrase, but what I often say to people is that for me, there are two fundamentals in good mental health. And one of them is curiosity. So being curious, what would it look like if I did it differently? Or what would my best friend say? Or how might I feel in 5 weeks' time? So that's one. And the other factor that I tell patients is how we handle disappointment. I think that is the most important aspect of getting on in life. So it's in essence resilience. So it's like the buoy, the cone on the water when it's buffeted by the wind or the waves. It rights itself. It comes back to center. And I think that if we're able to stand back and reflect on disappointment rather than drowning with disappointment, I think that together with curiosity if I had a mantra, it would include those two concepts.